And I tell people that by definition, and this is an ISO 9001 definition, which is the international standard for quality is whatever your customer says it is.
If you were competing right now
Mhm.
and you were in that like 10 location now, so you figure out the 5 location, you get up to that 10 or 14, what would you be doing right now if you were in that like 10 to 14 window location? Where would be your main focus?
So my focus if I was at that level is, it's really going to be based around my strategy. So there are 3 generic strategies we can choose from. One is cost leadership. So, at a given level of quality, we're the cheapest. And that's not to say that it's low quality. I always liken it to luxury cars. So, at the top line, you've got, say, Mercedes, Lexus, BMW, Audi, Porsche. None of those are cheap cars, but of those cars, one of them is the cost leader. So one of them is going to have to be the cheapest.
Yeah.
So, probably the Lexus or something like that. Again, high quality car, but still the cost leader. Or you can be a differentiator. So you can sort of say, hey, in some way, my product or service is better than my competitors, and therefore I can demand a premium for it. Kind of challenging to do in dentistry because we've done honestly a pretty good job of commoditizing dentistry.
Yeah.
It's sort of pretty hard for me to convince my patient that my extraction is somehow better than the guy down the street.
Yeah.
Or,
and even if it is, they don't realize that till much. It's almost like when you buy batteries, right? And it's like, my battery's better than this battery. Well, until you use it all the way and it's 6 months later and I use the whole pack, you really don't. It's really hard to compare side by side.
Absolutely. And for the most part, patients don't really know good dentistry from bad dentistry. All they know is if you were nice to them and if you hurt them.
Yes.
So, they're not going to know a good amalgam with, tertiary anatomy carved in. All they're going to know is that either this filling fell out of my head when I walked into the car park, or it's in there and it's comfortable. That's all they know. So, that's the second strategy. And the third strategy is a focus strategy where I'm going to focus my efforts on a specific market segment, whether that is providing implants, doing ortho, or even sort of focusing on specific demographics within a market. So I might say, I want to focus on, the Chinese speaking community in a specific geographic area. So that's a legitimate sort of strategy. So, what would I be doing if I was at that 14 location mark? I'd be saying, well, what's my actual strategy going to be? Am I going to be the cost leader? Because if I'm the cost leader, all of my messaging has to be focused around that, and all of my systems and processes have to support that particular strategy. So if I want to be the cost leader, I can't go around saying that I'm going to buy the most expensive equipment because simply that doesn't work.
Yep.
But
you can't have fish tanks with sharks in the lobby when say you're the cost leader, right?
Exactly. And by the same token, if I say I'm differentiated and I'm going to I do the best.
Well, before we jump to that thought, I want to pick something. So every dentist tells me we're the quality person, right?
Yeah.
We're the quality. So how, like, I know how to, like, I have an answer from this from a marketing perspective, but how do you deal with that when everybody says they're the quality leader?
So what is quality? I actually ask my clients this all the time, and I tell people that by definition, and this is an ISO 9001 definition, which is the international standard for quality is whatever your customer says it is. So if your customer says, I want a red car, and you build them the fastest blue car in the world with, whale skin leather seats and, a V20 engine, it's not quality because they wanted a red car.
Yeah.
So,
I don't think from a marketing perspective, I don't think a lot of people understand, like, if you want to really convey, like if you do dental implants, you really want to convey quality, you have to appeal to the emotional side, because general dentistry is more about proximity. Do you have good Google reviews? And did you answer your phone? And do you have an appointment within the next couple of days? If you're going to say, okay, well, what are the best quality from a dental implant or a Invisalign or braces or whatever, then what you're really saying is I have to educate this patient on what that quality means. And that's one of the hardest kinds of marketing to do. And then you say, okay, well, I'll appeal to their emotional side. And if you appeal to their emotion side, it's like, well, they're not able to eat, so we're going to help you eat again. But most
Yep.
dentists don't think that way because it's so far removed from the tactical part of dentistry.
You are 100% right there, Gary. And one of the things I speak to my clients about is how do you articulate a value proposition? And,
Mm.
you know, as we know, a value proposition comprises an emotional as well as a functional component to it. And I always tell my dentists this, and a lot of dentists are very, very good at being technicians,
Yeah.
but, you know, people don't buy the product or the service. They buy the benefit that that product or service provides. And I always point to something like, you see those drug ads on TV, it says, oh, you take this drug and it's going to reduce your A1C and it's going to do this and do that. But then you look at the imagery in the background, no one cares about reducing the A1C. The benefit of doing reduction in the A1C is that I can go to my grandson's birthday and
Yes.
have a
I can
piece of
play
cake.
now with my
Yes.
kids. Yeah.
So it provides that benefit of the benefit. And, giving a value proposition, and people talk about value propositions all the time. It's sending a message, and we know that messages or sending a message has three components. One is the sender, one is the actual message, and one is the receiver. So before people go through and talk about their value propositions, I actually encourage officers and my clients to go through and do something called a brand mantra exercise,
Mm-hmm.
because a lot of the time the brand mantra is intended for the staff, and it's the staff who are ultimately articulating the value proposition to the patients. So if the staff really don't have a good sense of what the brand stands for and what it represents, it's very, very hard for them to send the appropriate message that's going to be received by the receiver in the way you intend
Yeah.
it to be.